Hello student, today we will discuss about treatment modalities for cancer, surgeries and radiation therapy we saw in previous video. Today we will discuss about chemotherapy. So what is chemotherapy? Chemotherapy is a chemical substance used for the treatment of cancer in order to kill the cancer cells. So what's the main objective of chemotherapy? The main objective itself, destroy the malignant tumor cell without excessive destruction of normal cell. See, while giving radiation therapy as well as a chemotherapy, the destruction of normal cells will not take place, okay? It will be focused to only targeted cells, that is a cancer cells only. So what are the main goal of giving this chemotherapy? One is to complete cure. Second one is to control the growth of cancer cell, to slow the growth of cancer cell. Sometimes the malignant cell will be grow fast, okay, to reduce that fast growing. And finally has a palliative. See, when client is in a third or a fourth stage, there will be a lot of symptoms will be there. It gives lot of pain to the client. Pain due to pain, one is a pain, and due to obstruction also there will be a severe. So in such condition, reduce the burden of cancer cell, the therapy, chemotherapy will be given. So how this chemotherapy work? It will directly or indirectly disrupt the reproduction of cells by altering biochemical process in cells. Means it will penetrate inside the cells, damage the DNA. When damage the DNA means simultaneously biochemical changes will take place. So reproduction will not take. So it will completely kill the cancer cell, or it will reduce the growth. Means by reducing the multiplication of cancer cell, it will reduce the growth. Okay, what are the indication of chemotherapy? So the main indication in case of cancer is a fast spreading, it will be given. The second, the tumor cannot be resected. Through the surgery, the doctor is a try as much as possible to remove the tumor as well as the cancer cell, but it may not be possible completely. So after the surgery, through the chemo, they will try to remove the cancer cell. So they will be given. To cure the cancer completely, some of the cancer can be cured. The first line treatment itself is the chemotherapy. Through chemo only can cure. Older client, if they cannot undergo for this anesthesia surgery means they will be treated with the chemo as well as a radiation therapy. Or the client is suffering with a major health issues like heart disease, kidney disease, liver disease. Anesthesia cannot be given, so they cannot undertake for surgery. They are treated with the chemotherapy, radiation therapy as well as other kind of therapies. CT can be used as an adjuvant. Adjuvant means a supportive therapy before the surgery as well as a post surgery. After, before means to reduce the cancer cell, so it is easy for the doctor during the surgery, and after surgery, at least wherever the cancer cells are remain, to kill that. So classification of chemotherapeutic drugs. So based upon its chemical nature and function, the drugs are grouped under several, okay. So you can write down this, okay, and you can go through once if they ask me to answer it. Okay, at least some of the drugs you should know theoretical point of view as well as a practical point of view. During the exam, they may ask for the 2 marks as well as a practically. So that's a very, these all the drugs are very easy to pronounce, okay. There are plenty of drugs are there. At least you be familiar with these many drugs. Cisplatin, cyclophosphamide, doxorubicin, vincristine, vinblastine, 5-FU, methotrexate, procarbazine, methylprednisolone, mitomycin C, and carboplantin. At least study this, okay, today. Very important. Okay, route of administration of a chemotherapy. It can be given through IV, IM, subcutaneous, or orally. As well as it can be given regional, topical, in the form of cream. It applied to skin. If the cancer cell is in a central nervous system, instillation medication through an implanted reservoir placed in ventricles. Through the surgery, they will open, and in ventricle, they will place the reservoir. So the observe means it will start to kill all the cancer cells. So what are the major side effects of chemotherapy? nausea, vomiting, diarrhea, constipation, alopecia, loss of hair. Put underline for this, okay? For 1 marks they will ask. Giddiness, weakness, blurred vision, means they are unable to see properly. Everything will look like a 2-3. They are prone for several kind of infections. Stomatitis means inflammation of the mucous membrane of the mouth. Mucositis means inflammation of the mucous membrane of the entire gastrointestinal system from the mouth to anus. Dry mouth, bad breath, loss of appetite. They feel always like a sick only, unable to do any work. They feel to sleep only, lethargy. Skin and nail changes. The nail will be very fragile. It will cut and go. Skin, it looks like a dry skin. Altered memory and a concentration. They may not be able to remember anything. Poor to concentrate. Reduction blood volume. For this only they are prone for all kind of a infection. That is a CBC, HP, WBC, platelet. Bruising and a bleeding. Why bruising and a bleeding? Due to decreased platelet count. So very important, the nurses has to, when preparing the client for the chemotherapy, you have to explain all these side effects. Okay, hypersensitivity reaction means what? So, the nurse have a complete knowledge about this before starting the chemo drugs. Hypersensitivity reaction means severe form of allergy. Because when chemo drugs go inside the body, immediately the body react in a way and it gives, it will come out in a various symptoms. That's the severe symptoms. Dyspnea, difficult to breathe, cyanosis, bluish discolorization of the skin, chest tightness, chest pain, severe pain abdomen, inability to speak. They will speak like blah blah. Skin rashes, urticaria, tachycardia, heartbeat will be increased, pulse rate will be high, hypotension, decreased BP. So in order to prevent all this, so before starting, however, doctors will do their responsibility, but what is the nurse's responsibility? Obtaining allergic history from the patient, and before giving any medication, giving a test dose and waiting for the half an hour and observing for any reaction. If any reaction, informing to the doctor. If no reaction, continuing the medication. Stay with the patient when medication is on flow. Keep all emergency equipment and drugs near, and you have to see that all the equipments are whether in a working condition, cardiac monitor, SpO2, suction operators, everything, not when patient is a bad running here and there. And always put 3-way cannula when starting chemo drugs. If any anaphylactic reaction, what are the nurse's responsibility? If allergic has taken place, severe form of allergy, what nurse has to do? Immediately the nurse's responsibility is stop the drip, stop drug administration, maintain airway, see that whether patient is breathing properly, start oxygen, put a mask, connect cardiac monitoring to monitor all the vital signs. IV access, put 3-way cannula. So before starting chemo drugs only, you have to put the 3-way cannula. That is better, okay? Place the client in a supine position with feet elevated. Why feet elevation? Because venous return, in order to bring the blood pressure normal. Monitor vital signs. Continuously have to monitor the vital signs. Inform the physician and carry out physician order whatever he say without the delay in order to save the client. Close contact and supervision of the patient. What are the nursing management of the client receiving chemotherapy? There is a close observation of the client, okay? Okay, nursing management is a very important before receiving chemo drugs as well as after received chemo drugs also. One is always when specially trained oncology nurse only has to handle the patient, that is a better because she will have a many more knowledge about the oncology. Assessing the client, history collection, physical examination is doing, medication history, like any history of any other disease, allergic history, any major health problem, blood reports, if any abnormal, just have a look on the blood report. If any abnormal in a CBC or any other, just inform to the doctor and carry out what doctor says. Educate the client and a family. Here not only you're considering client, even include the family also and educate them why chemotherapy they are giving, why what it does, as well as after the chemo, during the chemotherapy, what happens. Sometimes it will cause a like kind of a like a side effect, so the client has to bear for that, okay, cope with that, as well as after the chemotherapy, as I explained, side effects. So all the side effect you have to tell the client in a very rational way and tell them to cope with that. Psychological support, emotional support, and making the client to accept for the treatment as well as accept for the side effect. Explaining, so yes, explaining side effect and coping mechanism, keeping all the equipment and the drugs are available in the ward near the patient side, and it should be in a good condition. So these are the major responsibility of the nurse. So hope student you understood chemotherapy is a very important. They may ask it for the 5 marks. So remaining part we will discuss in a next video. This is a part 7. Okay. If you are not subscribe my channel, to keep in touch with my channel, subscribe the channel student. Thank you.